Hello, good day everyone. We are the group of
Osteomyelitis.
In this video, we will explain to you the meaning of this disease, the effects, the types, and many more. So, are you ready to listen in our video? So, if you're ready, let's start. Alright na!
What is osteomyelitis? Osteomyelitis is an inflammation of swelling, bone tissue that is usually the result of an infection. Bone infection may occur for many different reasons and can affect children or adults. Also, it is more common in younger children, 5 and under, but can happen at any age. Boys are usually more affected than girls. It may also occur as a result of bacterial bloodstream infection. Sometimes it's called bacteremia or sepsis that spread to the bone. This type is most common in infants and children that usually affect their long bones like the femur, thigh bone, or humerus, upper arm bone. When osteomyelitis affects adults, it is often involves the vertebral bones along the spinal column. It can also occur from a nerve infection due to traumatic injury, frequent medication injection, a surgical procedure, or use of prosthetic device. In addition, individuals with diabetes who develop foot ulcers are more susceptible. In any of these situations, the organism has a direct portal of entry into the affected bone. It can result from an infection somewhere else in the body that has spread to the bone, or it can start in the bone, often as a result of an injury. Individuals with weak immune system are more likely to develop of this disease. These include people with sickle cell disease or HIV, or those receiving immune suppressive medication like chemotherapy or steroids. Types of osteomyelitis. The first one is hematogenous osteomyelitis. The second one is anaerobic osteomyelitis. The third one is osteomyelitis due to vascular insufficiency. The fourth one is osteomyelitis pyogenic acute. The fourth one is osteomyelitis pyogenic chronic. And the last one is vertebral osteomyelitis.
How common is osteomyelitis? Osteomyelitis affects about 2 to 5 out of every 10,000 people. It's one of the oldest diseases on record. Scientists have traced it back more than 250 million years ago. Who might have osteomyelitis? Osteomyelitis affects people of all ages and genders. Children younger than 3, the elderly, and people with serious medical conditions are more prone to the condition. In children, the infection is more likely to affect long bones, such as those found in legs and arms. In adults, bone infections more often target the spine. So, what are the types of osteomyelitis? Types of osteomyelitis include: first, acute osteomyelitis. This infection comes on suddenly. You may have a fever and then develop pain in the infected area days later. The second one is the chronic. Chronic osteomyelitis is a bone infection that doesn't go away with treatments. It causes bone pain and recurring drainage. Rarely, chronic osteomyelitis doesn't have symptoms. The infections may go undetected for months or even years. The last one is the vertebral osteomyelitis. This type affects the spine. It causes chronic back pain that gets worse when you move. Treatment like resting, heating, and pain relievers don't help. It rarely causes a fever. People who live in nursing homes, misuse intravenous drugs, or on dialysis are more prone to spinal bone infections. The categorization of osteomyelitis as acute or chronic is based on the histopathological findings rather than the duration of illness. Acute osteomyelitis refers to infection before the development of sequestra and usually takes place within 2 weeks of disease onset. There are two major classifications of osteomyelitis. The first is the Liu and Vogel, while the other is by Cirne and Mader. Liu and Vogel classified osteomyelitis based on the duration of illness as acute or chronic and by the mechanism of infections. Contagious infections is further classified based on the presence of or absence of associated vascular insufficiency. While the Cirne and Mader provides guidance in this, the classification of the osteomyelitis is by anatomic stage and the host health of status. The categories and corresponding anatomic types are: Stage 1. Disease confined to the medulla of the bone. Stage 2. Superficial disease. Stage 3. Localized spread. Stage 4. Diffuse disease. The local and systematic factors which define host health status are: A. Normal host. BS. Host with systematic compromising factors. BL. Host with local compromising factors. BSL. Host with both local and systematic compromising factors. C. Host for whom treatment of the osteomyelitis is worse than the disease itself. The cause of systematic host compromise are malnutrition, renal and hepatic failure, diabetes mellitus, chronic hypoxia, neoplasma.
Osteomyelitis is one of the oldest diseases ever recorded. Early diagnosis is very important because fast antibiotic delivery may prevent permanent bone loss. Bone is usually good at fighting infection, trauma, surgery, or foreign body insertion that can disrupt blood flow and lead to development. The word osteomyelitis, which defined an infectious infection affecting the entire bone, was coined by French physician and renowned surgeon Augustin Latin. How is osteomyelitis diagnosed? How is osteomyelitis diagnosed? Blood tests that look at white blood cells and inflammatory markers, which are typically higher during an infection, are typically part of extra workup to check for organisms in the blood flow that may be the source of the infection. A blood culture
Before we proceed to our next topic, I have some fun fact about bones. Did you know that bones stop growing in length during puberty? Bone density and strength will change over the course of life. However,
I'm Ashley Alares and I'm going to report the treatment and prevention of osteomyelitis. Doctors rely on X-ray, blood test, MRI, and bone scan to get a picture of what's going on. A bone biopsy helps determine the type of organism, typically bacteria, causing the infection so the right medication can be prescribed. Most of the people with osteomyelitis are treated with antibiotics, surgery, or both. Antibiotics help bring the infection under control and often make it possible to avoid surgery. People with osteomyelitis actually get antibiotics for several weeks through an IV and then switch to a pill. Specific treatment for osteomyelitis will be determined by your doctor based on your age, overall health, and medical history. The goal of the treatment is to cure the infection and minimize any long-term complication. Treatment may include medication, administration of intravenous antibiotics, which may require hospitalization or may given on an outpatient schedule. Oral antibiotics treatment may be very extensive and lasting for many weeks. It is important for the patient to continue to take antibiotics for as long as recommended by the treatment team, even after symptoms for the infection have resolved. Additionally, monitoring of X-ray and blood tests, pain management, and bed rest are one of the treatment for osteomyelitis. The surgery, in some cases, surgical intervention may be necessary to drain infectious fluid or to remove damaged tissues and bone. Now, we are moving forward. Now, we are going to move forward to how we can prevent a osteomyelitis. It is important to clean and treat wounds to keep out bacteria and prevent infection. If you have a certain bone break or surgery, contact your healthcare provider at the first sign of any infection. Beside of the pain and inconvenience of repeated infections, getting osteomyelitis under control early provides the best chance of recovery.
Fun facts about bones. Did you know that bones are made up of calcium, phosphorus, sodium, and other minerals as well as the protein? Traditionally, osteomyelitis is a bone infection that has been classified into 3 categories. Number 1, a bone infection that has spread through the bloodstream, hematogenous osteomyelitis. Number 2, osteomyelitis caused by bacteria that gain access to bone directly from an adjacent focus of infection seen with trauma or surgery. And number 3, osteomyelitis that is the result of diabetic foot infection or any other reason for diminished blood supply to the bones. Therefore, risk factors of bone vulnerability to osteomyelitis include recent trauma, having diabetes, being on hemodialysis, intravenous drug abuse, and having one splint removed. Osteomyelitis is an infection frequently caused by Staphylococcus bacteria, while some cases of osteomyelitis are of unknown causes. The infection is usually transmitted through the bloodstream from one area of the body to another. These blood infections are commonly due to Staphylococcus aureus, Streptococcus species, and aerobic gram-negative bacilli. If the patient has a compromised immune system, M. tuberculosis, Brucella species, and fungi should be included as possible causing agents in the disease workup.